Hi everyone, my name is Damon. I'm a data business analyst at HDR UK. And today I'll be talking to you about the enhanced gateway that we've developed. And so actually, show of hands, how familiar is everyone with the HDR gateway? Is anyone familiar? Oh, cool. I thought no one was going to be. So that's great. But for those who, because I'm a data analyst in the back end, I don't get to do these too often, so I'm not actually sure what the reach is. But for those of you who aren't familiar with it, you can think of the gateway as trying to be a common entry point for data discovery and access for health-related resources. And so I'll try and have time later to do a live demo, but one thing that is important to note is that on the gateway, we don't hold any raw data or patient-level data. We only collect or store and display metadata descriptions. So that's one thing that's really important. I think people often get confused. Even though we list data sets on the gateway, we don't actually hold any of it there. But the idea is that we can sort of collate together and show everyone what data sets exist and standardize that sort of output for people. And so when I say metadata descriptions, I mean things like population size, coverage, data access process, and titles, abstracts, and things like that. And so like I said earlier, we have about 900. I think it might be 1,000 by the time I'm giving this presentation, not too sure. But the way we've developed it is we have a metadata schema that people upload their data to. And so if, as a researcher, if you're on the website and you're browsing through data sets, it's all standardized. So you're getting quite a, what's the best way to describe it? Like a common theme throughout all data sets, basically. And it's worth noting, I won't be going into this too much, but we also have an advanced search feature called cohort discovery that works across a subset of data sets on the gateway. Now, this is a lot more specific, as it says here, but the idea would be if you were looking for a query that you're doing a project and you need to know, you need 500 patients that have asthma and are male, for example, you might not get that from the descriptions on the gateway. But using cohort discovery, you can type those queries in, change those parameters, and you can start to get counts back from these data sets. But of course, with the 900 descriptions, that's much broader, so you don't need any account. That's very open because the data is not sensitive. Whereas using cohort discovery, you start to get into that row level of patient data. So that one does need an account. You need to request access and go through a whole process there. But I'm not going to go too much into cohort discovery today. And so, yeah, the whole idea of this sort of platform to make data more findable and really help researchers and custodians either present or understand bits about the data set before having to reach out to spend time and start asking and querying questions. And yeah, it's like I said, it's supposed to minimize time. And so the other part, so that's sort of data discovery. The other part is sort of the data access side of the user journey in discovering what's data is available in the UK and beyond, to be honest. And so we're trying to build this into the platform. So if you're a researcher and you want to, if you haven't got enough information from the metadata descriptions that are provided by the custodians, you can actually submit inquiries, and I'll go into the data access part in a bit, but the inquiries is very much like your first port of call if you want to ask a few questions, basically, because not all data sets will have the same level of completeness of metadata. And so the idea is, again, we can do this all on one platform. So you'd imagine it's more of a central point for people to come and find out information. And we're actually redeveloping our data access module so you can actually complete a full data access on the platform for custodians, again, so you don't have to be doing different processes. So there may be questions that change between custodians, but at least the process is more or less very similar across the board on this website. And yeah, the data access and the inquiry forms are all aligned to the 5 safes. And yeah, it's very important as well to note that while we sort of facilitate the ability to do this, we don't make any decisions or affect any of the processes of this. All the interactions will be between yourself, the researcher, and the custodians. Yeah, we just sort of allow this to happen on the platform. And also, yeah, it's worth mentioning that access is also not granted on the gateway. Like I said earlier, we don't hold any of the data, we just facilitate you seeing it. So once, I guess, you've got access through the data access module, you'll be then given access outside of the gateway. And yes, so this is to help make the data more accessible. It's all in a centralized space, and yeah, the idea is, again, to streamline this journey. And so I mentioned data sets earlier, but we also have a data use register. And this is for the reuse of data. So the data use is also joined up with the data access module. So if you request access using the data access module, it will automatically create a data use for you in the data use register. So all the information you have already put into your access will flow straight through to here. So the idea is that this makes things more transparent. You can see what data projects and uses of data sets have been sort of done, basically, across all the data sets that have been uploaded on the gateway. And yeah, this helps increase public confidence. And this was all based off the national standard for data use registers. And this was developed by the HDR UK Alliance. Then finally, the other side of health data resources are the tools and publications. So we also allow users and custodians to upload publications that may be linked to datasets. So you can imagine we're already trying to build a sort of ecosystem of all the things that might be linked to a dataset. And from that, you can actually maybe, if a couple of custodians link to similar datasets, you can actually start to build this sort of network behind everything, even though it might not be apparent upfront, especially sometimes not to the custodians themselves, because they may be working on the dataset in some way, someone else uses it a different way. But we have the linkages in the back, basically. And this is to support interoperability. So yeah, I'll skip to. And this is just a very quick example, but this is the linkages we have for datasets and publications. So I'm not going to dive too much into this, but being the data analyst, I thought it's quite interesting to look at. You can see on here that you can see it might be quite small for you, but basically these are the datasets that are in blue, and in orange are the publications. So you can already see there's like a web of datasets and publications and all the linkages between them. As sort of blobs, some of them it's loads of publications from one datasets, or loads of datasets using one publication to produce one publication. But the idea again is that this is all happening in the background, so that navigation, like I think the idea is later on when we develop the gateway more, you could actually navigate this sort of network rather than having to know, you'll see later on the I do the demo, but it's not as clear as this, that this is all happening in the background basically. But yeah, I don't want to dive too much into this. And so yeah, originally we developed this back in 2020 during COVID, so it was really rapid and quick design. But we spent the last year and a bit trying to redesign and redevelop the sort of underlying technology so that it's far more modular, scalable, and we can actually work on user feedback that we get from all of you guys. So yeah, when we did the redesign, we used over 50 workshops, solution appraisals for requirements, and we launched in about November 2024. And so some of the features we used to have, like the data access module, we've now redesigned so that, again, it works for a far more broad range of custodians. And so I'm going to try and do a live demo. And I think we all know there's pretty much a curse going if you do a live demo, but let's see how this goes, basically. Which time do I have? 10. Oh, amazing. Right, so this is the gateway platform itself. And unfortunately, because I only have a small screen, you're going to see it on a smaller screen. But you can see these are the types of data entities that we show on the gateway. So you've got data sets, biosamples, the custodians, scripts, data users, like I mentioned earlier, and data custodian networks. So that could be your TREs, where we collate together all the data sets that might be within a TRE. So again, you can actually understand which TREs you may want to contact if they have the data sets available. But I think, and news and events and other things like that. I don't think I have so much time, so I think I'll just jump into data sets for now. So I'll give you an idea of what we're looking at here. And so this is our search page. And again, we've gone through a bit of a redesign. So I don't know if you were previously on the gateway back a few years ago. It looks a bit different now. And the search is far more improved. I'll say that for one. But anyway, if we go here, and so we mentioned earlier about BHF, so I figured let's do that. So like looking at their data set, they've got quite a good sort of completeness of metadata on the gateway. But again, metadata sort of ranges from like some custodians don't have that much data to provide, some do. So you'll get quite a broad range, but the idea is we are constantly trying to work with custodians to increase the richness of this metadata. This is the problem with live demos. I wonder if I already have it up. Okay, right, let's pretend that I just loaded that up. Okay, because I, in like Blue Peter fashion, like I had this earlier. So this is the VHF data set. So you can see it's got quite a rich amount of metadata. And so the way we've laid this out is we put at the top these sort of blue panels where we've gone out to researchers and users, and they've specifically requested these are the main things they wanted to know, at least up front. And so what you can do is you can navigate, you can see the population size, you can click through, and it'll take you to the more descriptive bits of metadata. And so I'll quickly scroll down, but we are working to sort of improve the format and the layout and the UX experience of this, but the idea is right now we just want to make sure you can see the data there. How much time? Okay, let's go. And so not only are we showing metadata that the users have put, but there's other things like I think you mentioned the coverage and completeness links to VHF themselves. Again, I have done it early, but if you were to click this, it will take you to VHF where they have their coverage and completeness, where you can then explore that data set a bit further. But also, I think we know with this data set, it's actually made up of loads of other data, smaller data sets, and it's more like a ERE kind of style. And you can see all those relationships. So within there, these are all the data sets that make up the VHF's data set. And so again, this is another way for you to explore what actually is within the gateway, what's linked together. And if you actually wanted to go to the original custodian because you think that might be more important to you, you can click this, it'll take you there, and then you can read up on the original source, I guess, or the data set this is derived from. And the way the gateway works is that if you have an account, you can add this to your library, you can go back to it, and from there you can actually start requesting like inquiries and access. So I think I will quickly try. Should have brought my mouse up here, but it's okay. So yeah, we have the sort of access here at the top. So you can make a general inquiry, fills out this form here, and this will both send a message on the gateway and via email. So again, I know in the past custodians haven't always wanted to just use the gateway platform. Email is often more user friendly for them. So this does both. This will send the email and you can just track your messages through there. But what it does do now in the new enhanced gateway is it allows us to track the email responses as well. Not what's in the email, but who's responding. So then again, if you're a researcher and you reach out to someone and they don't quite reply, we actually have the ability to see, oh, maybe someone's taking a long time. We can actually follow up for you to make sure people are using this feature and things like that, which we didn't have on the previous website. What else? And again, yeah, the submit application is for the DAR module, but I'm pretty sure it's not been launched yet, but it is in a couple of weeks, I'm pretty sure. And you can also download metadata as well. So depending on which data sets you're looking at, you can download the raw metadata to look at in your own time, I guess. Anything else I'd like to show very quickly? I wanted to show you all how this will work. And so that's one data set, I guess. And like I said, we've got over maybe 1,000 on here at the moment. But also there are different ways you can categorize or group together data sets in other health resources. So if you look at the data custodian networks, for example, you can already see some of the sort of TREs and things that actually mentioned earlier. And so then you can see which custodians, at least that have been onboarded onto the gateway right now, fall within each of these custodian networks. You can see which data sets are available there and which tools, which publications, and you already, I guess, hopefully you can see that with how we're trying to build this network in the back. And again, I think the long-term goal is with all these linkages, while they're quite basic at the moment, is to put them into a sort of graph-styled backend, basically, so that navigation isn't just you clicking through it. It would be a bit more, I want to say AI-driven, but if you can imagine that sort of idea of if you've got all these graph and nodes in the backend, you can start suggesting based on what other people have looked at, what linkages actually exist, whether it's direct or indirect, how you might want to navigate. Doesn't have to be so driven by your own knowledge, I guess. If you haven't got any. I got a minute? Couple minutes. I'll stop there. I definitely have missed a lot. I feel like I've had to rush through this, but is there any questions? I feel like questions is probably a good thing to go to now.
I think I remember from a previous talk from Lara that she mentioned that there was some extension big text.
Yes, that's a good thing to mention.
Because for many people, sometimes it's not so obvious. That maybe it's not a research question.
Yes, so for those again, if you use the previous gateway, it was very much a specific match on whatever you searched, and that actually led to quite difficult search UX or user journey, basically. So I think the whole search has been redesigned. It uses Elasticsearch for the match. I'm not sure which is the best, but we can go through. Do you want to give me a research? This is another live demo thing, but do you want to give me? Sometimes I would say Clara normally gives this demonstration, so not as fluent, but if you want to look up asthma, if you misspell asthma as well, that would also appear within the search. So it's okay on that front. The only thing I would mention is if you put too many search terms in there, at the moment it might crash the search. But we're talking like whole paragraphs into the search. We're actually looking to fix that very soon. But yeah, this is more for those who had seen the previous search.
Can you scroll down?
Oh, yeah, of course.
Like primary care, you search primary care. Or maybe you can put in primary care, but just like, does it just bring anything with an asthma?
So it should match on anything with asthma.
Okay. Say, for example, these are primary care. Wouldn't necessarily.
Yeah, of course.
Would bring that
up. Not 100% sure, but I mean, if you knew that you wanted CPRD as well, there are filters on the left-hand side, so you could go through that route as well. And I'd imagine if you typed in asthma and CPRD, I don't actually know if this is what you're asking, but I guess I'm doing it now. Actually, there are some of the CPRDs there. But again, it depends on how Elastic is indexing. So it might be rating the term asthma higher than CPRD in the background. But again, we're still working out the best ways to optimize this search. So as we do more work on this should produce more reliable. So CPRD might appear at the top. But again, I would say if you wanted to look at CPRD, probably use the filters rather than type it in the search. But yeah, keep going. Yeah. Yes. So often what will happen is a custodian, as they upload the metadata for their data sets, there's an option for them to add in linked publications. So they will often upload publications. But what we're also developing is a way for us to query Europe PMC automatically whenever a data set is uploaded. So we'll start querying their titles and things like that and pull back anything that comes from Europe PMC, and we will automatically add that linkage in. So it's not actually as manual. It used to be everyone just had to upload their publication and then link, and we would actually miss lots of linkages. But now it's moving to a more automated fashion where we will just query Europe PMC, PubMed, and if a data set does come back and matches, we will create that linkage. I'm not 100% sure if it's shown yet because we're still trying to work out the best way to store that data, I believe. But yes, it's not always the case that you have to manually upload it, but you can do it as well, I'm pretty sure. So you could upload the publication yourself and then add the linkage there. That's your question. Cool. Yeah? Yes. I'm not sure. I'd imagine it would bring back the ICD-10 code within the publication and the ID, because we do terminology mapping with Medcat, and there's another one which I'm not sure. Brandwin usually does the search for our website. But publications are a bit different. So within the metadata for data sets, I think we would, or I think it should. Publications, because the data comes from PubMed, I'm not sure if we're bringing back the metadata that has those disease codes or ICD-10. So that might not actually be in the publications. But I say, give it a go. Go on the website, try it, and then you can maybe let me know if that is there. And if that's something you want, there's the need support, and you can give us feedback. So most of this is driven by user feedback, and that's really what we're trying to. That's really how we're trying to develop this. And so it's actually best if you go on here and you're like, oh, actually, this would be really useful. Just submit it as feedback. We actually go through loads and lots. Most of the things we develop is purely based on user feedback. I think, as I showed earlier, like this whole redesign was mainly user feedback driven. Yeah.
Brilliant. Yeah.